The Healthcare Security Cast is sponsored by 3D Network Technology. Reliability is our core value. Visit www.3dnetworktechnology.com. And by Genetec, delivering security strategies for healthcare. Visit Genetec, that's GENETEC.com. And by the Change Execution Group. Visit 360lifetransformations.com. Before we get into today's show, I want to invite you to connect with the Healthcare Security Cast on a new platform. It's a text-based platform called Community. To join, all you have to do is text my community number, and that number is 647-372-2042. That number again is 647-372-2042.
Welcome to the Healthcare Security Cast, the podcast dedicated to healthcare security, safety, and emergency management. If you are involved with a healthcare security program or desire to be, this podcast is for you. Join the conversation as we discuss the issues that matter to healthcare security professionals while leveraging the expertise of healthcare security thought leaders and experts in personal development. And now, here's your host, Brian Hamilton.
Welcome to the Healthcare Security Cast for Thursday, October the 15th, Day 5 of IAHSS Healthcare Security and Safety Week. There's still just a couple of days to have your recognition featured on the Healthcare Security Cast. If you wish to do so, send me a text message at 647-372-2042. That's 647-372-2042, and we'll get you on the podcast. Before we jump into the recognition, we'll be joined again by Canada's recognition expert, Sarah McVanel, as she shares her recognition tip of the day.
This is your Healthcare Security and Safety Week recognition tip of the day. Let's talk about unconditional recognition. We often don't think about this. We think about how can we acknowledge people when they are going above and beyond, and the top performers, the people who really are your shining stars. However, what about when people make mistakes? What about when somebody's late and it had nothing to do with their error? Or maybe it did, and they generally are pretty consistent, but once in a while they mess up. What about if a project goes way over schedule? Well, these are the times when your ability to recognize the greatness in people stands out all the more. When you have pretty high performers, these are the people who beat themselves up when things don't go exactly according to plan or when they're not performing at their optimal level. By you being able to acknowledge them in those moments, not only will they be more likely to live into your high expectations and your belief that they are still a great performer despite this current blip, you'll also be role modeling to other people or who are perhaps hesitant to put up their hand and step out of the fold and step out of the group to maybe be a little bit bolder, to try something a little bit less comfortable and unfamiliar, because you create an environment where people can be human beings, not just human doers. My name is Sarah McVanel, Canada's recognition expert. Thank you so much for what you do as well.
Thank you, Sarah. And to hear more from Sarah, go ahead and listen to episodes 24 and 39 of the Healthcare Security Cast, and also check out her website, greatnessmagnified.com. And now let's get right into Day 5 of celebrating our healthcare security heroes.
Good morning, everybody. Paul Allena, Security Director here at Capitol Health in Hopewell, New Jersey. Wishing everybody a very safe and happy and well-deserved 2020 IAHSS Recognition Week. We often take for granted what we have, but more importantly, the staff that I have here is second to none. Their commitment, their dedication, just above and beyond during the last number of months during COVID. I'd like to again call them out, congratulate them, thank them for their dedication and commitment. Thank hospital administration for allowing us to provide, this level of service day in and day out. Thanks to the volunteer leaders at IAHSS, management staff, leadership staff, everybody that makes this week what it is and what it will continue to be for the profession. Thank you.
My name is Chris Murray. I'm the regional manager for GardaWorld Protective Services in the Atlantic provinces located in Halifax, Nova Scotia. GardaWorld represents over 20 healthcare locations across the province of New Brunswick, and I am proud to have the opportunity during Healthcare Security and Safety Week to thank the countless officers and supervisors supporting our healthcare clients across the province. We believe strongly in the support and the recognition of our members, our frontline workers. We recognize their dedication, their sacrifice, their acts of valor with different things like awards, certificates, handwritten thank you cards. These recognitions are also supported by our clients who take the opportunity to award our officers with what they call bravos. Bravos are awards the clients give our security officers for acts that they've done above and beyond the call of duty. This is just another amazing way that we get to say thank you to the officers and recognize them for the service that they give to our clients. Today, I also wanted to take a moment to do a special shout out to an officer who this summer put her life in harm's way to protect her site during an incident involving a visitor who had become hostile. Using her training and experience, and in my opinion, her sheer courage, put herself in between the individual and the staff and patients of this hospital until law enforcement could arrive. Because of her actions, the individual was apprehended without injury to any others. With that said, I would like to say thank you to her and all of our healthcare officers this week for being our everyday heroes.
Hey, Bryan, thank you for all you're doing to recognize and increase awareness of our healthcare security industry, and definitely for this opportunity to recognize the great work that's taking place at my organization. For those of you that don't know me, my name is Joe Magana. I'm the System Director for Security, Safety, and Emergency Preparedness at Norton Healthcare, located in Louisville, Kentucky. So I'd like to give this opportunity to give a shout out to a few different groups during Healthcare Security and Safety Appreciation Week. The first is I'm so thankful for all of our officers who are the backbone of our security program. They're out and about each and every day to provide a safe environment and create positive experiences with everybody they come in contact with. They've been able to complete their daily duties in a professional manner and quickly adjusted to many changes in our environment with the pandemic, civil unrest, restricted, and there's just so much more that I could list. So thank you to all our officers. Thanks to the safety and security leaders who are high reliability performers, engage in their duties and set a positive example for their teams to follow. To my system team, who do all they can to exceed expectations to ensure our hospitals, practices, immediate care centers, and system location resources, support, and training to meet their daily challenges. To the Norton Healthcare executive team who provide outstanding support, and I'm so thankful for the continued investment in our security program. To my boss, Andy McCarthy, who provides excellent leadership, support, and sees the true value of everything we're trying to accomplish in all of our programs. And lastly, I just want to say thanks, or say that I'm truly honored to partner with everyone at Norton Healthcare in the best interest of our staff, patients, and guests, as their safety is our number one priority in everything we do. So thank you, everybody, for this great celebration week. I greatly appreciate all that you do.
I'm Bryan Bailey from Sturdy Memorial Hospital. I'm the Director of Safety and Security. And I just wanted to wish my crew here at Sturdy Memorial Hospital a happy and healthy healthcare safety and security week. And thank you for everything you've done over the last couple of months with the COVID-19 outbreak that we've had. So I just want to say thank you for everything.
All right, hi, how's it going, guys? My name is Karminder Ghai. I am the Assistant Manager for Public Safety here at William Osler Health System. I look after the three sites, which is Bradford Civic Hospital, Etobicoke General Hospital, and Peel Memorial Center. So corporately, I do work with all three sites. Of course, with COVID-19 hitting in play back in March, I still remember that first day. I was like, wow, this is actually happening. Going from, wearing a nice suit and tie to automatically wearing a full-out PPE suit with regards to masks, goggles, and yeah, so, wearing a full-out suit and obviously being out there at front line with, screening individuals that, at the moment you're new to as well. And, making sure that, you're following the process in play. But, just talking about, it is Security Week. A lot of great things to say about the public safety team. Our team has, we've hit a lot of strides, but at the same time, we've risen to the occasions of, going above and beyond and stepping to the plate when need be. With our code whites, for example, used to be a regular code white. Now we have to look at the protected side of it as well, due to the fact that some individuals may have COVID. So it's not the easy process where it used to be, where you can just go and assist on a call, you got to make sure to look at the precautions and, wearing PPE, donning and doffing appropriately. And I think that our staff have done a really good job of doing that. Just making sure that not only are they just going to the call and, protecting the patient and thinking about the patient safety aspect of it, but also their own safety and staff safety. Our staff have been, some of our staff members have been just tremendous of picking up shifts. A lot, back in the days, if you're not feeling well, you take the time off and then you're back on it once you're 100%. Obviously, with the new rules and changes that are being implemented, it takes a lot longer for staff to come back. So some of the staff members that do work with us continue to pick up shifts and work these long hours. And and I wanted to say thank you to those guys, because it takes a lot. I know it takes a lot on your body, but that mindset, that mentality, that spirit that they have about coming into work and supporting their teams, I think that it goes a long way. So some great things of that aspect. I want to recognize what our staff do is de-escalating, and how it's been effective and it's come a long way. I've been getting a lot of calls and a lot of messages from our stakeholders that our staff are pretty much go to a call, assess the situation, and don't right away just go by what the directions provided. They actually de-escalate the situation beforehand, and I think that is a very important tool that sometimes can be missing these days, is having that effective communication, right? And I think that our staff have come a long way with that, and providing that effective tool to our patients and to our staff members. And some of the staff members have noticed that, wow, public safety and security have come a long way with that, and they're actually talking to these patients and getting to know what's going on and hearing both sides of the stories and figuring out an action plan or solution without going hands-on. And that's tremendous. IAHSS, our staff have been meeting the requirements, and I think they've been doing a great job, and they've had full engagement into the new processes as well. So I'm really glad to hear that they're very intrigued, and they're very excited to do the testing and to get their certifications, not only for their public safety careers, but also any future careers that they do have. But yeah, overall, I'm just very happy and very, I want to thank the public safety team here at Osler as well for doing such a tremendous job and doing the great work that they were doing and keeping the standards high. And I think that's the biggest thing. And, they have a great representation of our department, and I'm very glad to work with this team.
Hi, everyone. I'm Derek Bailey, Security Manager with Hamilton Health Sciences, manage 4 out of the 7 sites of Hamilton Health Sciences. Just want to give a big shout out to our frontline security staff that have been working diligently since the start of COVID-19 back in March. And want to throw another shout out to some of our partners. We're a hybrid department, so we have in-house security staff that look after the majority of our sites. But we do partner with GardaWorld, and I wanted to say thank you to their frontline staff as well. Without them and the partnership, it would be hard to do what we've done. And it would go without saying that I need to thank all of our clinical teams and our relationships and our partnerships with them as well. It's really made sure that we've looked after our families and our patients well, and hopefully into the future as well. Thank you.
Before we conclude today's recognition, we're joined once again by Chris Littlefield of Beyond Thank You, as he shares tip number 5 for nurturing a culture of appreciation.
Hi, I'm Chris Littlefield from Beyond Thank You, and here are 7 tips for nurturing a culture of appreciation. Tip number 5, crowdsource meaningful compliments. And you can do this very easily via Zoom right now. So your people, your frontline staff are working with a group of people every single day or every single night, depending on the shift. Get those people's contact information, inviting them all to a quick 15-minute Zoom where you're going to make a video to say thank you to that person. Hit record, tell everybody they have literally 30 seconds each to record a message to that person, have everybody record a quick video message, hit stop, save the message, and then send it to that individual. You're going to get the compliments that are going to be most meaningful to that employee, because those are the people they work with the most. Thank you, Chris. And to hear more from Chris, check out his website, beyondthankyou.com. That's beyondthankyou, all one word, .com. Thanks again for joining us for Day 5 of Healthcare Security and Safety Week. Join us again tomorrow as we continue the recognition. Until then, stay safe and take care.